Diraj, you mentioned that atrial fibrillation and heart failure, they are closely interlinked. AF can be both a cause and effect of atrial fibrillation. Can you remind us, Diraj, of the evidence that patients with coexisting heart failure can have significant prognostic benefit from ablation of their AF? Remind us of that evidence.
Sure. So as you rightly said, Yasser, atrial fibrillation and congestive heart failure are the two cardiovascular pandemics of this century. Both of them are becoming increasingly prevalent, as you know too well, in primary care, and they often tend to coexist with each other, and they often tend to worsen the prognosis of the other condition. So when they do occur together, it's very important that we try and control what we can. Now, as I mentioned right at the outset, in normal sinus rhythm, atrial contraction contributes about 20% of the cardiac output. In atrial fibrillation, that 20% contribution is gone. Now, in patients with congestive heart failure, they can ill afford to lose that atrial kick, the atrial transport. And so they can often slide into heart failure once they develop atrial fibrillation. So it's extremely important that we are proactive and we make sure that we control this. Now, there have been several high-quality randomized controlled trials which have been published in the last few years, which have addressed this issue and which have shown that catheter ablation for atrial fibrillation in a heart failure population improves outcomes. The most famous of them is the Castle AF trial, which was published in the New England Journal 4 years ago now, but also the Cabana heart failure subtrial, the East AF heart failure subtrials have all shown that if you are proactive, you actually get more bang for your buck, as it were. You get much more benefit in the heart failure population and much earlier on than you would in patients without heart failure. I would also like to specify here that when we talk about heart failure, we're not only referring to patients with systolic heart failure. We are also referring to patients with diastolic heart failure, which actually is even more common. As we know, diastolic heart failure is becoming more and more common, especially in the older age group where AF tends to coexist. And those are the patients, the ones with stiff left ventricles, where the atrial transport is absolutely critical. And when in AF, that transport is lost, these patients tilt or tip into heart failure. So I always recommend to my general practice colleagues, please do a simple test, an NT-proBNP. That will give you an indicator of patient's cardiovascular status in AF. If the NT-proBNP level is elevated, then by all means, refer the patient on for more proactive management.
Right. Again, and I think another very important cohort of AF patients that should be considered very early on for specialist assessment. So